Well, it's my research and those of other scholars. We've known for decades that Arab Americans do not share the privileges of whiteness. They face extensive prejudice and discrimination. They are victimized by hate crimes based on their identities. So they face substantial discrimination, but can't make these claims about it without the data.
They're more likely to live in larger households, multi-generational households. A lot of Arab Americans work in the food industry, are considered essential workers. We know that Arab Americans have higher rates of diabetes and obesity, both of which are comorbidities that increase severity of COVID-19. So there are reasons to believe that Arab Americans could be at higher risk for infection, severity, and maybe even mortality. But we actually don't have any data because we're not able to isolate Arab Americans from hospital data or from other large national data sets. Let's not wait for a top-down approach. Let's try to do this from the bottom up. If you're a healthcare organization, if you're a hospital in an area where there is a large Arab American community, I think it's your responsibility to add that checkbox, even if the federal government is not adding that checkbox. I think it will do a service to the community, allow you to cater to the needs of community members.
In Michigan, due to the alarming high rates of COVID and trying to identify, racial and ethnic folks that have been most impacted, the state of Michigan has added a race data category on the COVID-19 vaccine dashboard. I mean, when we're looking at race and equity, right, making sure that we're looking at all groups of folks and how they have been impacted by the pandemic and by this virus, it becomes incredibly important for us to be able to share data for education purposes, for prevention purposes, and just really letting folks know why it's important. That's something that we're constantly advocating for, a push to recognize that Arab Americans are being impacted like any other group, and how much it's hurting us as a population not being able to have that information to make the case, especially when you're looking at national data and being able to compare that to other groups and on a national level.
How do we share the dream of equality in America with everybody? How do we let everybody have equal access to upward mobility, to good health, to a quality of life? Look, many people do not have equal access to these things in American society.
I think it's really about being able to quantify and to count. And in doing so, I think you're also recognizing the lived experiences